But we were lucky. We had a number of really interesting and also clinically relevant studies presented. Might I just remind you of the two further large trials on an SGLT2 inhibitor, dapagliflozin and empagliflozin, again indicating a major benefit of these drugs in patients with heart failure and now also patients who have kidney disease. But I would like to point out a different trial. That's the LODOCO-2 trial. This is a trial who looked at the question whether colchicine will reduce events in patients with coronary artery disease. And in this large 5,000 patient randomized trial from Australia and the Netherlands, it did. It significantly reduced by approximately 30% cardiovascular events in patients who had known coronary artery disease with a single dose of 0.5 milligrams colchicine a day. So that's a breakthrough, and I think we will very soon find this in the guidelines. The ideal world here is that almost anybody who is interested can connect to this Congress and attend and learn and experience and share in the development of cardiovascular medicine. And this is what we're seeing here. We have far more than 100,000 participants who can join this Congress, while usually we have about 30,000 people, which is a lot, but who can come to the Congress. Now it is 3 times, almost 4 times as many people who can join. So this really makes it possible to get a much wider reach. We had lots of registrants from countries like Colombia who would otherwise not be able to attend this Congress. We have more women percentage-wise than we usually have. So this all shows that with this format, we can reach a lot more people. I would see this as an opportunity. As patients become more familiar and also trust the electronic communication more, and as hospitals and other practices set up the infrastructure, this is just another way in which we can keep connected with our patients. This will not impair the doctor-patient relationship, I think, because usually we build this relationship first, and then we go to electronic counseling, not always, but on occasions like these where the patients cannot reach the office. So I think, once again, this is a broadening of our spectrum, another tool that we have available, not the only one that we will be using, but I think we should feel and think positive about this.